So, talking about plain films or X-rays, we really know that the cost is much less expensive than any other imaging modality out there. So that's an advantage. It's highly available and it has high resolution. Actually, has a higher resolution than CT and MRI. And this is a very technical term, but in essence, CT and MRI, we really have other types of resolution. In CT, we have contrast resolution. In MRI, for example, we would have greater temporal resolution and even contrast resolution in addition to tissue characterization. The plain films are really high resolution, and therefore it's a modality that can allow a lot of detail even when it's not very expensive and highly available. The plain film assessment, the classic ABCS, which is for stands for alignment, bones, cartilage, and soft tissues. The alignment we'll review later, but we're really talking about four main lines that we draw around the spine. We have the bones, so we want to make sure all the bones are intact. Then we can assess the cartilage and the soft tissue as allowed by indirect signs from our plain film because these are not really well seen on plain film assessment. So here we have an example of a normal cervical radiograph. We have a nice alignment. All the bones look fine. They're equally mineralized and symmetric. So, and also the intervertebral disc space is maintained on all of the levels. So that's our way of assessing the disc. Although we don't see them, we see the height that should be maintained by the disc. We can see soft tissues or soft tissue swelling if it was present. Again, it's not very high sensitivity, but we still look in case there's something we can detect either subtle or major, and that would present with changes on the soft tissues with the plain film. So in this example, what I'm showing you is now the neural foramina or the schematic of the artery in which you would have the vertebral artery going through the cervical spine. You have the spinal cord and the neural foramina, which all play a role in our assessment of the spine, especially in the setting of trauma. In the image in the bottom left corner, you have the lamina, which is when we do a laminectomy for a neurosurgical procedure. Then the patient has surgery at this point. We have the pedicle, which is underneath the nerve root here. That would be the pedicle. And when you do fixations or a patient receive hardware fixation, usually the screws are called transpedicular because they cross through the pedicle. And you can think of the pedicle as a safe place to traverse the spine in order to reach the vertebral body. So those are the main components that you should be aware. Of course, you have the spinous process and the spinal canal here, but the main thing or the hardest thing sometimes to identify after you have identified the spinous process and the vertebral body is the lamina and then the pedicle, which in this case is really seen underneath the nerve root here. These are the lines I was telling you about, the four lines for assessment of the alignment of the cervical spine. And I think these lines are tremendously important. For example, the first one, the first line, you would draw it in the anterior aspect of all the vertebral bodies, and that's a good way to assess for alignment. If any vertebral body is displaced anteriorly or posteriorly, by drawing this imaginary line, you would be able to detect it. And we're pointing out to several structures here. First of all, we have the dens or the odontoid, and in this case, we also assess for the space in the atlantoaxial joint. We have the posterior vertebral line. As the name implies, we take the posterior aspect of the vertebral bodies and we draw a line through it. And you might ask, why are we drawing this line if we already have the anterior alignment? Well, in case of fractures, sometimes the change or the displacement might not be symmetric, so it's always good to assess the anterior alignment and the posterior alignment. You have the facet joints here, the kind of horizontal or I should say oblique, but predominantly horizontal lines here. We have the pedicle, which we discussed earlier, and we have the spinous process. For the spinous process, then kind of like the spinal laminar line is a little bit different. Some people would draw it at the base of the spinous processes and check for that alignment. And then you have the posterior spinous line, in which again it might have some variation because the spinous processes are not equal in everyone, and they're not necessarily the most symmetric portion of the cervical spine. However, we still try to get this general curvature when we draw our posterior spinous line. And I think that covers the main aspect of the assessment for a cervical spine alignment, which is your first, should be the first thing you look at when you're looking at the cervical spine. On the right, you have the schematic of what we're looking at. You have the two vertebral bodies, the intervertebral disc, and the nerve roots coming from the neural foramina, which we also assess, as I'll show you in a minute. Here we have the neural foramina, in which we can see nice and open spaces, and we can predict that the nerve is coming out from that neural foramina without being compressed because it looks like an open space. In the event of a fracture or severe degenerative disease, then we could have some obliteration of this area and therefore suspect that some of the patient's symptoms, in case you have neuropathic symptoms, can be coming from this region. On the left, again, is a schematic, and we're really representing the same thing, the neural foramina from the cervical spine. So plain film assessment, we covered the alignment. The other thing I wanted to cover with you is kind of the Scotty dog, which is a kind of like an anatomical reference or a schematic dog that we can imagine as we look mainly in an oblique view of the spine. In this case, we're looking at a lumbar spine, and the Scotty dog is a good anatomical reference. So we'll go over the Scotty dog in a minute, but I wanted you to be aware and see if you can identify it here. The same schematic here on the right, and I'm going to show you. This is a frontal view. Here you have the Scotty dog, like I said, mainly in the oblique views where you can see it, and this is a frontal view. And the question in this case is asking you to identify the structure we are pointing, which is indicated here by the arrow. And you have three different projections. You have the frontal view, you have the oblique view, and you have the lateral view, and they're all pointing to the same structure. So what do you think it is? So based on what we talked, this structure is going to be the pedicle, and it's I guess initially easier to identify here that we're dealing with the pedicle. Another way of seeing it, and you should also look for kind of like the face here, two eyes, and the spinous process represents the nose. And the whole idea for looking for the symmetry is that your eye would notice if there's a case in which you have an asymmetry, and then further inspect that level to assess if you have a fracture or a malignancy that can sometimes distort that anatomy. So all this and all images, what we're looking at is the pedicle. As you can see, it represents kind of like the head of the Scotty dog. In this case, this is the lateral projection and the frontal projection. So why is this important? So spondylolysis and spondylolisthesis are really technical terms to describe a defect, right? We're talking about lysis. You can think of it in biology like lysis of the cell. And spondylolisthesis already implies there's some shift or some change in alignment. So you can have spondylolysis, in which you have the defect but not necessarily change in alignment. And then once you have the change in alignment from the spondylolysis, then you have spondylolisthesis. The pars is the junction of the pedicle, the lamina, and the facet. We already reviewed the pedicle, so now we'll see where the pars is located in relationship to the pedicle. The spondylolysis is usually seen at the lower lumbar levels, L4 and L5. And spondylolisthesis, like I said, it will be a change or movement of the vertebral body in relationship to the one below. This is an example of a normal cervical spine, and you can see we still have some degeneration here, some increased sclerotic changes at the facet joints, which are here at every level. But in essence, this is a pretty normal lumbar spine. Sorry, I don't know if I said cervical. Lumbar spine, and we have the L1, L2, L3, L4, and L5 levels. You can see we have the symmetry in the quote unquote the eyes, and then we have the nose here. So we have this phase that we look for on the AP projection, and then you can think of the oblique projection as a projection in which you're looking for the Scotty dog and making sure everything's symmetric. So now I'm going to show you again the Scotty dog, but look what happened here. So we have a defect, and it's actually kind of like around the neck of the Scotty dog. So you have the pedicle, and then the neck would represent the pars area. So this is a normal pars, and you can see the head of the Scotty dog, the neck, and the leg would represent the facet joint, and that would be a normal pars. In this level, you already have a defect, and this is what we call a pars defect or spondylolysis. And that's an example of spondylolysis. We haven't identified any shift or any change in alignment to call it spondylolisthesis. This is a schematic diagram. Like again, you see the pars here, there's a lysis, and then if there's movement, then it's spondylolisthesis. And in this case, you also have some disc inflammation because there's more of a trauma or more significant trauma to this region. The alignment for anterolisthesis, in this case, we have what would be called anterolisthesis of L5 in relationship to S1. This line should really connect with the sacral line, and there are all sorts of measurements here in terms of the sacrum in relationship to L5, and again, here we cannot really appreciate the fact that there's a spondylolisthesis there or spondylolysis, but the main thing is to check for the alignment just like you did for the cervical spine. Okay guys, so that's it for this section. In the next section, we'll cover CT and MRI.